symposium about the side effects of diabetes on the eyes, especially the retina. The symposium discussed the various factors causing diabetes, including the hereditary factors, which can be detected through genetic analysis.
Diabetes mellitus is a common disease worldwide. It has two types, type 1 and type 2. Type 1 is insulin-dependent diabetes. This type 1 constitutes about or affects about 5 to 10% of all diabetic patients. It occurs in children from 5 to 15 years, but it is not as strict. It can occur in old age. This type must be treated mainly by insulin. Type 2, about 90 to 95% of all populations with diabetes had type 2. It affects older age, about above 30, but also it is not strict. It can affect children. This type can be treated by oral medications. Generally speaking, we have to know the symptoms of diabetes for a patient to be aware about it. Symptoms of diabetes are feel of thirst, fear of hunger, frequent micturition, loss of weight, delayed healing of wounds. Of course, to know the symptoms is very important because this will arise the early visit to the doctor.
Diabetes, which is commonly known as the white poison, affects the various parts of the human body: the kidneys, the blood pressure, the blood vessels, the heart, as well as the eyes and the retina.
Generally, diabetes affects microvasculatures in the body and peripheral nerves. Specifically, I will speak about diabetic changes on the eye. It can affect any part of the eye. For example, it can cause low corneal sensitivity. It can cause mono nerve affection. For example, the third or sixth nerve can be affected. It may cause ptosis or deviation of the eye, squint. This means it may cause cataract. It may cause glaucoma in the late stages. The most serious effect of diabetes on the eye is diabetic retinopathy, actually.
The Medical Society is currently focusing on studying the pre-diabetic stage for patients as means of protection. When prevented, diabetes can become a friend rather than an enemy.
My name is
Amro Osama. I got diabetes 4 years ago. I was 6 years of age then. I'm treating it as my friend. I'm eating everything but taking care of my insulin. I'm one of the Taekwondo champions. I've been playing Taekwondo for 7 years now. I've earned a lot of gold medals. The latest were 3 gold and 2 silver. With proper care and attention, diabetic patients can lead a normal life.